Hello, I'm Dr. Snehal, clinical geneticist from Navi Mumbai. Recently, on 21st March, we had World Down Syndrome Day, and you must have seen many awareness campaigns, much of information regarding this disease. Down syndrome is the commonest genetic disease. 1 in 1,000 babies are born with it every year, and it is an old disease, much old disease, studied, known to humankind. And still, why we need this celebration or awareness campaigns every year? Because as a community and from the healthcare point of view, we are still lagging in providing preventing options to the patients. In early detection during pregnancy, the options which are available are still not getting discussed to and reaching out to community at large. And after the birth of the baby, the care of these Down syndrome complications of these babies is not up to the mark, keeping pace with the innovations and the provision of health care, so as we can provide better quality of life to these children. We all know that in pregnancy we have maternal serum screening and nuchal translucency to detect Down syndrome risk in the pregnancy, and if the risk is high, we can apply invasive diagnosis by doing fetal karyotype during the pregnancy and give the couple option if the baby is affected. But we also have non-invasive prenatal testing now available widely and at a much lower cost. So we should, as pediatricians, as obstetricians, and also community health specialists, we should give these options to couples planning the pregnancy, because many of the times even young couples with all the pregnancy screens normal can have Down syndrome baby. So we at every stage we should give this option to the couple who is planning the pregnancy and during the pregnancy. Then in spite of this, if these options are not taken by the couple and a Down syndrome baby is born, we really have to take care of the complications, and many of the hospitals are doing it. But many patients, if there are no complications like congenital heart disease or other systemic complications, the routine monitoring of Down syndrome patients is not done, like thyroid, hearing, vision defects, and this hampers their development. They may have behavioral issues, they may have learning disabilities. They actually, if we manage this well, they can be accommodated in normal schools. So there is so much to do in Down syndrome patients, where we can really help them to give a normal life, accommodate with normal schooling. And hence, right from birth, we should give this monitoring and screening programs. So this World Down Syndrome Day, we really have to collaborate with each other, with all the specialties at every stage. We have to give this information continuously to the couples. And Down syndrome is actually helping us to understand more about genetic diseases. It is helping us about more about knowing about Alzheimer's disease, leukemias, and providing us the research opportunities. So we should be aware about the innovations happening in Down syndrome babies to prevent these complications, even if they reach at above 30 or later stage of life. And let us use these campaigns for reaching out to giving this message to the community at large. Thank you.